This week marks the 30th anniversary of the Family and Medical Leave Act. The federal law requires some employers to provide up to 12 weeks of job-protected, unpaid leave to certain workers. Our Sally Hernandez sat down with a group pushing for universal paid family and medical leave.
You say there are benefits beyond the obvious when it comes to paid leave. What do you mean?
Evidence shows that paid family leave has a huge impact on the health and well-being of people, particularly workers of color, who are less likely to access protections and benefits from their employers compared with higher wage and white workers. We also know that paid family leave improves the physical and mental health of new mothers, in particular single mothers with lower incomes, and it reduces rates of food insecurity in the year following a birth. So there are lots of both short-term and long-term benefits of a universal paid leave program.
You also say family leave strengthens the workforce and the economy. How?
We know that on a national level, based on research, that access to more paid leave and affordable childcare, as many as 5 million more workers would enter the US labor force, boosting the economy as a whole. If they had access to paid leave, workers would be more likely to stay in their job. They'd be more likely to work longer hours, and they'd be more likely to remain in the workforce. And this is all based on a number of different surveys and research that's been done on this topic over the last decade.
Do you expect President Biden to talk about this when he addresses the nation?
We know that advocates have been pushing for President Biden to make remarks on paid family leave in the context of the State of the Union address. We also know that this has been a top priority for the president in terms of addressing issues of equity in this country. Unfortunately, this is not something that the president can do on his own. He needs Congress to pass a law in order for paid leave to become a reality for workers across the country.